There's been a lot of news lately about the drug fentanyl, a very powerful and sometimes deadly drug. What is it exactly, and what should we know about it? Well, to answer such questions, delighted to welcome, she's Senior Director of Prevention and Abuse Treatment Services at RiverValley Behavioral Health, Dr. Ronson Clark. Doctor, as always, it is good to be with you. Please describe what fentanyl is.
Well, good morning, Mike. It's good to be here today.
Same
yes,
here.
we have seen and heard a lot about fentanyl lately. Fentanyl is a synthetic opioid. It's used to treat patients with chronic and severe pain, sometimes after surgeries. It's a Schedule II controlled substance that's similar to morphine, but about 100 times more potent. When a doctor uses it, it has legitimate uses. Not so when it's distributed on the streets, where it has potential for abuse and can lead to death. In fact, in 2019, we had about 37,000 individuals die from overdose deaths of fentanyl.
Where is all the fentanyl coming from, Doctor?
Most of it is being manufactured outside of our country in illegal labs in Mexico. It's shipped or smuggled into the United States, and it's mixed with other drugs to increase its potency. Mixed with powders, nasal sprays, pressed into pills to made to look like legitimate prescription opioids. They're mixing it with things like heroin and cocaine and meth. What we're now seeing, and I think this is real important, is a shift in drug trade. Previously, we've had a lot of drugs that were grown crops that required land, a growing season, laborers to work those crops. Now all we need is a manufacturing plant and a seaport to ship them out.
Let me ask you this. Obviously, there have to be tremendous risks about the illegal use of fentanyl. What are some of them, Ronson?
Well, first of all, producing any of these synthetic drugs is not an exact science. Few of these individuals have advanced degrees in chemistry. As little as 2 milligrams of fentanyl can be fatal, and that is about the size of a pinch of salt.
Wow.
Fentanyl blocks opioid receptors in the brain, and its most dangerous side effect is how it works on the brain stem, depressing it and making your brain think it's not important for your heart to beat or you to breathe. And this is what leads people to overdose deaths. It affects heart rhythm, leads to chest pains. It affects your muscles, high body temperature, stomach pains, swelling. It's very, very dangerous.
Very quickly, the final question. What help is available, Doctor?
Well, stopping fentanyl is very important. And doing it the right way is also important. It has to be handled, the withdrawal has to be handled by medical professionals. You can certainly call us at RiverValley at 1-800-433-7291, and we will walk you through the steps, and we can get you a medication-assisted treatment, which will also help with the cravings that go with opioid withdrawal and recovery from using these types of drugs.
Dr. Ronson Clark, again with RiverValley Behavioral Health. Doctor, as always, thank you very, very much for your expertise.
Thank you.
You're welcome. And before we leave you, folks, want to remind you for a chance to win a family 4-pack to the Hottie Shrine Circus, which is coming to the Ford Center Thanksgiving week. All you have to do is head to rivercityweekend.com, submit your name, and then we'll draw winners the next 3 Fridays. And of course, we'll announce the winners on our Midday with Mike Facebook page. As always, thanks for being with us. Have a great day. Come on back tomorrow. I'll see you again on Midday with Mike.